Alright guys, it's Dr. Mohammed. We are back for another public health sciences question. We've got about 15 seconds on the clock. Feel free to pause the video if you need some more time, and then we'll go through it. So the correct answer here was choice B. Would you feel more comfortable if a female examines the rash? This question was either really easy or quite confusing, but let's go through it. A family medicine physician is working in his local community clinic. The clinic is very busy and there are many patients waiting to be seen. A 56-year-old female with a past medical history of systemic lupus erythematosus and Hashimoto's thyroiditis presents due to a rash on her scalp. The patient is noted to be wearing a headscarf. After having her vital signs completed, the patient is brought back into a room to be evaluated by the physician. When the physician asks the patient to remove her scarf, she becomes visibly uncomfortable and states the rash is not bothering her very much and that she would like to leave. What is the most appropriate response by the physician? Now, this question might seem a little bit silly because it's basically two people having a conversation, but this type of question is very common on the boards and this is something that you might see, so I wanted to make sure you guys were aware of this kind of format. Again, taking that 10,000 foot view of a question so that we can better understand it, there's a male family medicine physician working in a busy clinic. A female patient wearing a headscarf comes in, complaining of a rash on her scalp. When she gets into the room, sees the male physician, and he asks to examine it, she becomes uncomfortable and says it's really not a big deal and wants to leave. Based on that information, we have to assume that there's some type of cultural or religious barrier there that's preventing her from wanting to be seen by the male physician. So we're going to do things a little bit differently this time, and I want to go through all of the answer choices first. Choice A, okay, I respect your decision to leave. Choice B, would you feel more comfortable if a female examines the rash? Choice C, what is making you so uncomfortable? Choice D, I need to evaluate the rash so that I can appropriately treat you. And choice E, I understand that you are uncomfortable, however this is a normal part of a medical exam. On the surface, it seems like all of these could be pretty reasonable answers, right? The physician isn't saying anything rude like, I don't care, you're wasting my time, get out of my office, or anything like that, so theoretically maybe these could all be answers. But when we look at this question, we need to remember what we're being asked about. We know we're in the public health sciences section, we know we're being asked about something regarding communication because it's a conversation, but more specifically than that, this question is testing our knowledge of culturally inclusive interviewing. And when we went through this in the lecture, we had certain steps that we wanted to take in a certain order to make sure that we were doing this appropriately. We wanted to identify the problem, we wanted to understand the background information, understand cultural barriers or restrictions, and then we wanted to come to collective solutions. Knowing that, let's go ahead and take a look back at these answer choices again. Choice A, okay, I respect your decision to leave. Probably not the most appropriate initial response, right? There's clearly some type of disconnect here. There's an issue with the patient-physician relationship. The patient is clearly uncomfortable about something, so there's clearly more work to be done here. We don't want the patient leaving when they come in with a problem. They could potentially be very sick for all that we know, so we would like to do our evaluation, and because of that, letting the patient leave is not correct, and that is why choice A is not the correct answer. Choice B, we're going to come back to because that was obviously the correct answer in this question, but choice C, what is making you so uncomfortable? This could potentially be the right answer. It seems like a reasonable thing. The patient's uncomfortable, we want to ask them what's going on, what's making them so uncomfortable. This is one of those scenarios where the question stem is telling you what's going on and the patient's reaction themselves is also telling you what's going on, right? Anyone reading this question should be able to see that the patient is uncomfortable taking her headscarf off in front of the male physician. And it might seem a little bit silly, but asking patients directly what is making you so uncomfortable kind of puts a spotlight on them and will act to make them more uncomfortable, and they're just going to shut down even more, and that's going to dampen that patient-physician relationship. The communication is definitely going to close down. So we want to approach this in a neutral, non-judgmental way as much as possible, and because of that, we don't want to ask questions like this directly, and that is why choice C is not the correct answer. Choice D, I need to evaluate the rash so that I can appropriately treat you. This sounds like something that's reasonable, right? This is a physician trying to do their job. The patient came in with a complaint, and the physician just wants to do an appropriate evaluation. However, in a situation like this where the patient is visibly uncomfortable, saying something like this and doubling down about your job and what you need to do is going to cause the patient to feel more uncomfortable. Another example that might come up on the exam, if there's a young female patient who needs a pelvic exam done and there's a male physician, saying something like, I need to do this pelvic exam so that I can appropriately treat you is not the right response. That is too stern, that is too harsh, that may scare the patient that you're forcing them to do something that they don't want to do, and because of that, choice D is definitely not the correct answer. And then finally here, choice E, I understand that you are uncomfortable, however this is a normal part of a medical exam. There is some factual information in there, right? A patient comes in with a complaint of a certain body part. The normal part of that exam is to examine that body part. However, the first part of that response, I understand that you are uncomfortable, could be a little bit tricky. We know the patient's uncomfortable. The question directly tells us the patient is visibly uncomfortable. So this isn't something that we need to acknowledge again, that we need to state, that we need to tell the patient, I know you're uncomfortable. That's kind of, again, coming at it from a judgmental place. It's putting a lot of spotlight on the patient. It's going to make them feel even more uncomfortable. So yes, this is a normal part of a medical exam, but saying that the patient is uncomfortable, kind of putting that on them, is why choice E is not the correct answer. And that brings us back to choice B. Would you feel more comfortable if a female examines the rash? This is the correct answer because this is addressing all of the things that we talk about when it has to do with culturally inclusive interviewing. We've already identified the problem. The patient's wearing a headscarf. They don't want to be seen by a male physician. They're visibly uncomfortable. We know that. In terms of understanding the background information, we might not understand it completely. We don't know if this is just because of a religious thing. We don't know if this is a cultural thing, but regardless of that, we know the patient's uncomfortable because of it, so it needs to be addressed. We've identified some type of influences and barriers to this care. This patient has a belief system where wearing a headscarf, shielding her hair, covering her head from whether it's society, whether it's male specifically, whoever it is, this is something that's important to her. We know this, so we need to figure out how to address it. And this response here in choice B is how we come to a collective solution. We know the patient's uncomfortable. We're going to indirectly address that, and we're just going to ask the patient, would you feel more comfortable if a female examines the rash? This is an indirect way of saying, I know you're uncomfortable. I hear you. I understand what's going on. How can I help you? How can I make this easier and less uncomfortable for you? And that is why choice B is the correct answer. This may have been a bit more of a difficult question for some people because it's a lot of nonverbal cues here, and we need to make some assumptions about why the patient is feeling a certain way and how we can respond to that. And while a lot of these answer choices may have seemed reasonable, when we see questions like this on the exam, remember, we want to be neutral. We want to help the patient as much as possible. We don't just want them leaving because they're uncomfortable or something like that. And we want to be able to come to collective solutions, whether that's calling a family member because they want someone else in the room, whether that's getting spiritual services involved. There are a lot of things that we can do without being judgmental to the patient, without forcing them to do things that they don't want to do, that'll allow us to come to collective solutions and will help to grow and nurture that physician-patient relationship. Hopefully you got this question right. If you did not, I recommend going back to the public health sciences section and watching the video on inclusive interviewing. But that's it for now, and I will see you in the next one.